Chapter 8 of ICD-10-CM is for diseases of the ear and mastoid process. As there are currently no official ICD-10 guidelines specific to this chapter, we will focus on clinical scenarios specific to the chapter, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter H. If you remember from ICD-9, these codes all started with number 3 and were part of the nervous system chapter. ICD-10 created a separate chapter for diseases of the ear and greatly expanded the number of codes due to increased anatomic specificity, including laterality, which is extremely important for conditions of the ear. One more change from ICD-9 is that there are many more code-first underlying disease notes. For otitis media, which is categories H65 and H66, documentation must indicate whether the condition is initial or recurrent, and also if the condition is occurring in the right or left ear or bilaterally. Now I'd like to do some examples for this chapter. First, we have a 4-year-old male seen for acute ear pain. Exam reveals left acute serous otitis media with a total perforated tympanic membrane of the right ear. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is H65.02, acute serous otitis media, left ear. Start by looking up otitis in the alphabetic index, then locate serous indented below. Next to serous is a note which states, see otitis media non-suppurative. After locating non-suppurative indented below otitis media, there is a heading for acute, and then indented below this is serous, which points to H65.0, with a checkbox next to it indicating that more digits are required. After finding H65.0 in the tabular, we see that the code for left ear is H65.02. The second code is H72.821, total perforations of tympanic membrane, right ear. Start by looking up perforation in the alphabetic index, and then locate tympanum tympanic indented below with membrane in parentheses as a non-essential modifier. Indented below this is the term total, which points to H72.82 with a checkbox next to it indicating that more digits are required. After finding H72.82 in the tabular, we see that the code for the right ear is H72.821. You'll also notice in the tabular that there is an instructional note stating code first and the associated otitis media. You would therefore know that it would not be appropriate to code this condition first. Remember, you would not code the ear pain because it is a symptom of the confirmed diagnosis. Symptoms are only to be coded if a confirmed diagnosis has not been made. Our next example is a 45-year-old male with bilateral conductive hearing loss due to non-obliterative autosclerosis of the staples of the oval window. He is unable to hear with hearing aids and has decided to undergo left stapedectomy. During the surgery, an inadvertent laceration was made to the tympanic meatal flap, which was repaired. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is H80.03, autosclerosis involving oval window, non-obliterative, bilateral. You would start by looking up autosclerosis in the alphabetic index and then locate non-obliterative indented below. Next to non-obliterative is a note which states see autosclerosis involving oval window non-obliterative. After locating this indented below autosclerosis, we see that our code is H80.0 with a checkbox next to it indicating that more digits are required. After finding H80.0 in the tabular, we see that the code for both ears is H80.03. The second code is H95.31, accidental puncture and laceration of the ear and mastoid process during a procedure on the ear and mastoid process. Since the laceration was a complication of surgery, you would start by looking up complication in the alphabetic index, and then going to ear procedure indented below, followed by intraoperative, and then laceration, where there is a note which states see complications, intraoperative, puncture or laceration, ear. When we follow these directions, there is an option below the word ear for during procedure on ear and mastoid process, which points to H95.31. You would then confirm this code in the tabular. Though a complication is present, the reason for the encounter was surgery for autosclerosis, and the complication was resolved. Therefore, the complication code would not be coded first. However, if the reason for the visit was to repair the complication, then that code would be sequenced first. Now it's time for our quiz. Our first question is, what is the correct coding for acute recurrent serous otitis media of both ears? Our second question is, if a patient has acoustic neuritis due to an underlying parasitic disease, which condition is sequenced first? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is H65.06, acute serous otitis media, recurrent bilateral. You would start by looking up otitis in the alphabetic index and then locate serous indented below. Next to serous is a note which states see otitis media non-suppurative. After locating non-suppurative indented below otitis media, there is a heading for acute, and then indented below this is serous, and then recurrent indented below, which points to H65.0, with a checkbox next to it indicating that more digits are required. After finding H65.0 in the tabular, we see that the code for recurrent and bilateral is H65.06. The answer to the second question is the parasitic disease. The way that you would know this is by looking up acoustic neuritis. Start by looking up neuritis in the alphabetic index, then the word in is indented below, followed by parasitic disease. Here we see B89 listed first, which is from the infectious disease chapter, followed by H94.0 in brackets. If you remember from the introduction to ICD-10 webinar, brackets indicate a manifestation code, and these codes are never to be coded first. If you forgot this rule, when you confirm H94.0 in the tabular, there is a note which states code first underlying disease, such as parasitic disease. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 8 of ICD-10-CM, Diseases of the Ear and Mastoid Process. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.